An organisation in Cape Town has been testing whether a TB vaccine usually given to newborns could help protect hospital workers against COVID-19. The clinical research organisation known as TASC has been criticised for allegedly failing to provide participants with protective gear during this trial. For more on the study and the criticism, I'm joined via Skype by TASC founder and CEO, Professor Andreas Diakon. Prof, a very good afternoon to you. Thank you for being on ENCA. So the drug that you are testing, the vaccine in fact, is BCG. What about it makes it potentially a way to protect health workers?
Yeah, thank you for having me here. It is known that BCG protects babies from tuberculosis when they are children, and there has been observations that it protects adults from certain, mainly viral respiratory disease like COVID-19 is one. And we are now conducting a study to investigate if perhaps, lower the symptoms of COVID-19 disease.
And let's talk about how you're going about conducting this trial, because half of the volunteers will be given BCG, a shot, while the other 50 are given a placebo shot of a simple saline solution. Explain all of that in simple language for those of us who aren't in a lab.
Yeah, this saline solution, this is just a placebo. So we want to find out if there is a difference between those people that receive the real vaccine and those that don't. And so over a year, we keep telephonic contact with these individuals, and we interview them about whether they have been infected, and if they have been, how severely ill they were. And at the end, we will compare these groups for the severity of their symptoms. And this is a so-called double-blind design, so we do not really know what they received, and the participants themselves don't know either. So the assessments are all very fair and neutral.
And all of this testing will take about a year before you have some sort of conclusive outcome. So it's not going to be the immediate measure that we need to protect health workers ahead of that peak in COVID-19 infections.
It certainly is not the solution to the problem, but right now in the situation we're in, I think everything that can help is probably welcome. And we are monitoring the results of the trial basically real time by having a committee appointed of experts that actually do know who received what, and they could inform us if there was a very strong protection given by BCG so that we could stop the study and inform everybody about the results. But I have personally not an insight into these results before they are made public by that committee.
And there has been some controversy around BCG, Prof, because when the pandemic was ravaging parts of the US, China and Europe in the earlier months of 2020, some had said we're seeing lower mortality in countries where BCG is indeed administered to children, and perhaps that was why we were seeing lower mortality numbers. But that study was not peer-reviewed. Will what you are doing now be what finally puts that debate to rest?
That's exactly what we want to do. There is a lot of hype around BCG and around what it can and what it cannot do, because it's a very safe vaccine that has been given to children for many years. The risk-benefit ratio is very beneficial. So if it helps something, then it's probably something one can roll out very quickly. So people are excited about it, even though, what we really need is a proper COVID-19 vaccine, which is probably still a year or two, perhaps even 3 ahead.
Very briefly, Prof, please. There has been controversy where you are concerned, some rights groups accusing you of not providing the people, the health workers on whom you are testing this vaccine with PPE, some saying you've not consulted adequately. What is going on?
Well, we've been consulting with an advocacy group, a different one, when we planned the trial. And, this personal protective equipment is just, if you're in the context of a healthcare worker who all work in healthcare facilities, it's just one part of infection control strategy, personal hygiene, personal protective equipment, and then you have the locations, how the patients are isolated, how they're transported. And these are usually given instructions by the hospitals or the healthcare facilities, infection control managers or health and safety managers, and they will be clear instructions to these healthcare workers what protective equipment they need to wear in what situation and when they need to take it off and where they can move with it. And we felt that from our little research study, it's not our place to interfere with these rules and regulations that will be very different in each and every healthcare facility.
So from your side, you are not putting them in danger, is that what you're saying?
If there was a risk to the vaccine we give, that's where we would put them in danger. But I think we do not interfere with their work conditions or the work they need to do. If there's anything that puts them in danger, it's the virus.
All right, Professor Andreas Diakon, he is the task founder and CEO of that organization that is conducting those trials on a vaccine that could potentially spare health workers from the effects of COVID-19. Let's come